Hello, I'm David Butler, and I'd like to tell you a little bit about a really effective therapy using mirrors and a mirror box. This could be useful for a range of pain states, for example, some of those nasty problems like complex regional pain syndrome and also phantom limb pains, but it could also be really useful for some less severe pain states like arthritis in the thumb or even carpal tunnel syndrome. The mirror box first. You can make your own. You can do the ultra cheap version of a mirror on a beer carton, but I think it's best to get yourself a more professional box. Key points from a mirror box. We like to use a triangle, and the key points are that the mirror is perspex and good quality. You don't want a glass one that you're going to drop and have glass everywhere. Secondly, make sure that the mirror is not bowed, because if it's bowed and makes the hand look bigger, it can sometimes make pain worse. Secondly, you'll need plenty of space inside, so you can move the hand without touching the sides. And thirdly, we think it's important that it's collapsible, so you can take it home, you can use it on the beach, you can use it standing, sitting, at the office, on holidays. Because successful use of a mirror sometimes means you might have to use it for an hour or even 2 hours per day. Okay, a few points about using the box. The key point is that the illusion must be complete. So spend some time making sure it is. Sit comfortably. It's best to start off in a nice, relaxed atmosphere. Put your hand in the box and forget about it. But then if you have any rings or watches, or if your sleeve is down, take them off. You're trying to trick the brain. Secondly, it's very important that you understand what you're trying to change. And you're actually trying to change synapses in the brain. See this drawing here? It's a map of the sensory system in the brain. It's kind of like a human. Can you note how the hand is big, but so are the lips and the face? Areas of your body that need to be more sensitive for best survival and function are large. And actually the brain changes all the time to look after you. What we also know is that if you have a pain problem in your hand, and particularly one that's been there for some time, and particularly where the hand hasn't been used properly, the hand in the brain will change shape. Very often getting larger, kind of smudgy, sometimes smaller, but we know it's changed, and we do know that using a mirror can bring it back to its original shape. Now, there's many tricks you can use. I'll just give you some examples of techniques. You can make up some yourself. We recommend that the hand in the box is left still, at least initially. And some of the things you could do include just looking at your hand, turning it up and down, starting to use each finger, touching the other thumb, taking weight on it. But just remember, if the problem hand hasn't done this for 6 months or a year, this could be a little bit too much. So you'll need to grade this. You'll need to work out a certain amount of activities that you can do that you feel comfortable with before you progress. Other techniques could be just crawling on the mirror, increasing the strength. You could also use objects. Get a pen, get a pair of scissors. And if that other hand used to use a certain tool at work or at play, try and use that as well. You can also take your head into the mirror as well too. Remember in that little drawing that the face is next to the hand? So if you can bring your hand and rub your face, go across your face, you're going to be helping to restore that little image in the brain as well. A final technique. Once you've progressed, you might like to start to move the limb in the box. For example, you could be doing an activity here, and you could replicate it in the box. At the same time, still looking at the hand here. Feels a bit strange. You could do it reciprocally as well. And finally, a technique that's also useful, and quite useful for some of the arthritic hands. For example, if squeezing my hand hurt, ow, 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 if I did that same movement in the box, like that, same movement in the box, but maybe just short of hurting it, and then I did the movement here more aggressively, this will usually improve. You can also use a mirror for stiffness. If you've had your hand in a plaster cast or a bandage for some time and it's stiff, for example, this is a very common stiff movement after it's been immobilised. You could do this movement in the box, but with this movement, do it even more. And you'll usually help some of the stiffness. It kind of tells us that stiffness is not just in the tissues, it's also in the brain as well. Finally, mirror therapy by itself is often not enough. Mirror therapy is part of a graded motor imagery program that might involve laterality reconstruction in the brain, imagery, and as well as a return to graded activity. You can read more about that on the www.noigroup.com website. And finally, brains construct or reconstruct when activities are done in different contexts. We've already suggested you should use this at home, at work, on holidays, but if you can do these activities in different contexts, it'll be even better. So do it in different light, different times of day, with people around you, with music, in quiet times. Have people laughing. Do it in different emotions. All of this helps reconstruct a healthy brain. So best of luck with mirror therapy.